日本臨床歯周病学会40周年記念大会 YouTube ライブ。皆さんお待たせいたしました。ここからのお時間はゲストにテレサ・チャンティさん先生、ポール・リン先生をお招きし、デンタルインプラント for Aesthetic Reconstruction と題しましてお話を伺ってまいります。インタビュアーは清水宏康先生、木村文彦先生です。お願いいたします。
ありがとうございます。Okay, so I'd like to welcome Dr. Teresa Chantin-san and Paul Rim from Taiwan.
Thank you very much.
And thanks for the great presentation at the last session. Okay. And first, could you give us something about your hometown and where you're practicing?
Thank you so much, Dr. Pauline. So I'm from Taipei. I'm practicing in Taipei right now. And I'm practicing in McCain Memorial Hospital. It's a hospital setting, but I'm specialized in periodontology. And also I'm teaching in a postgrad program to interact with some of the postgrad students as well.
I also graduated from Ohio State and come back to practice in Taipei for 28 years. And over these years, I've been also teaching in National Taiwan University. And I practice mainly focusing on perio and implant and aesthetics. And my practice is very close to actually presidential, office and or legislative yuan. So in that area.
It's a very, very fancy, high-end area, I would say.
Yeah.
Thank you.
Actually, we visited one time at,
Yes.
at his clinic. Yeah, very nice clinic. Okay. So this is 40th anniversary of our society. And during this 40 years, the concept of dental implant had been changed. So 30 years ago, we all didn't know what is the cause of the marginal bone loss around the implant. So my question is, what is the key factor of achieving the long-term success of dental implants? For both you guys.
So as you can see, I'm a very young dentist, so not as experienced as Professor Lin, but my topic was about on the emergence profile and then also on dental implant aesthetic. Mm-hmm. And I think one main message that I would like to deliver is there's a lot of very useful digital tools that we can use nowadays. And I think planning is the most important factor before you execute the dental implant treatment. So I guess from my end, do a very well planning that's going to help you to maintain the long-term implant success.
Okay. Planning is very important. I think execution is also as important. Mm-hmm. For execution, I think you have to be skillful in technique and be more confident when you're doing that. I do not recommend exercise on your own patients. Mm-hmm. There are courses available for you to excel yourself. So over the years I've been having some courses available for the young dentists. I think for achieving aesthetics, to try to respect what the soft tissue can do is very important. Over the years, people has been look more into the bone foundation, as a main or only, which is probably not going to help with the implant aesthetics. Aesthetics-wise, superficially, it's actually composed of mainly soft tissue. Mm-hmm. So soft tissue stability is the main issue, is what I think.
Okay. I know you guys are very professional and you have great skills. And this meeting, many young dentists is participating.
Yeah.
Okay. Thanks.
So Teresa, you said you are still young, but of course you're younger than me, but you are not the beginners. So and also Paul, you are like a hero in your countries, living in the nice areas. So we want any suggestions for the younger dentists who wanted to become like you?
So I'll go through a little bit of my experience. So I have my periodontal training back in Boston in Tufts University. That I was alumni with Professor Shimizu as well. And so I think the experience of to explore your comfort zone by, for example, to a different environment, starting a board or attending different meeting like us coming to Japan to join your meeting, it actually really will inspire you in your daily practice. And I guess this kind of inspiration is going to be even have more huge impact on a younger generation. So I will encourage all of the young generation that can potentially join all of these international big events. There's no border for the country. Just go around and then explore.
Very nice. Thanks.
Very good. Yeah, she's a good example. Mine is poor in the example. I find out a little too late. You know, after I come back from Ohio State and practice, the first 10 years is a waste. I've been trying to employ what I was learned in the United States and treating Western people and trying to treat my own, populations, and I find difficulties to achieve a similar result. Then I realized that literature can help you to go somewhere, but not all the way to the end of your practice. So you have to be, not limited by your own knowledge, and don't be limited by your own imagination. Try to have your extent. Try to be yourself. You are creative in your own thinking and your way. I think literature can help something. Evidence-based is only to some limit. It gives you a car to drive with, lower speed. But sometimes you have to need gasoline with your own imagination and your pursuit with open mind. Sometimes in your hand you can create something different. That's what I've been trying to perspire, hopefully, for my own future, and hopefully a recommendation for the young generation. Thank you.
Okay, thank you. Yeah, so this is a great message for the young dentist. Okay, so it's time to close this session. Okay, yeah. Okay.
Thank you.
Thank you.
Okay.
Thank you so much.
Yeah.
Thank
so
you.
much.
Bye.
Thank you.
ありがとうございます。
次の配信は17時からを予定しております。お時間まで今しばらくお待ちください。